Welcome to SBB University Senior Care Spotlight. I'm Kathleen Warshawski. Today's Spotlight, we're featuring Dr. Nancy Oppenheimer-Marks with Home Instead. Welcome, Nancy.
Hi, Kathleen. How are you today?
I'm doing great. And yourself?
I'm doing just fine, thank you.
Excellent. I see you're working from home today.
I am, as I have been since March 24th. All the staff has been working from home. We take turns going into the office, and everybody seems to be enjoying this setup. I personally miss seeing my staff, my caregivers, and my clients, so it's a little bit of a hardship. But I think being at home is the best thing we can do for everybody until we get rid of this virus.
Well, excellent, excellent. It's good to hear that y'all are taking turns so that each of you gets a little bit of going into the office time, and then you get a little bit of working at home time too. It's a nice balance, I'll bet.
It is, it is. Yes, they take more opportunities to go in than I do, since I'm in a higher risk group.
So tell us a little bit about the services that Home Instead is offering.
Well, Home Instead Senior Care is a non-medical in-home care company. We offer any services really to keep our clients safe at home and have a good quality of life. Separate from home health care, we are not medical. We don't do therapies or medication administration, things like that. But we do personal care, transportation, meals. Actually, it's really whatever the client needs. It's sort of a concierge kind of a service. So we plan what the client needs with the client themselves or their family.
Excellent, excellent. And you all offer short pieces of service versus long pieces of service. So for example, you'll offer 24/7 care, and then if someone just needed a bath or a little bit of service, how does that work?
We have a 1-hour wellness check.
Okay.
And we can be there for 1 hour up to 24 hours, 7 days a week. Again, it's client choice. It's what the client needs to stay safe in their home or wherever they're residing at the time.
But if my mother needed to just have you come in, say 3 times a week to give her a bath, you can do 3 1-hour visits a week. Is that correct?
Sure, whatever the client needs. 7 days a week, 1 day a week. We have clients that just need us once a month. It really depends on where our clients are with regard to feeling safe at home and feeling that they need help doing certain things that they can no longer do well.
Okay.
So, yes.
Wonderful. And how long have you all been in the Dallas area? I know you've been here for quite some time now.
Right. So Home Instead Senior Care was developed in Omaha, Nebraska in 1994. Paul and Lori Hogan saw a need with their own personal situation that they had to take turns staying with a loved one, and they realized that there's a better way. You know, we could maybe put people to work and keep our grandmother at home safely and have a good quality of life. And so they formed this company in 1994, as I said, and I bought my franchise and opened up in 1999. So I've been here for 21 years and watched the home care industry grow from maybe myself and a couple of other companies to probably over 1,000 licensed companies in the Dallas-Fort Worth area. So it's an enormous new opportunity that a lot of people have seized to help seniors, to help baby boomers.
Right.
Because we are getting older and we are the ones that will need help, but we don't need medical help yet. But we may need help in other situations that don't involve anything that's medical related. I'm watching my 103-year-old mother-in-law, who I can't see because of the coronavirus, but she is doing very well and has full-time care and is just as happy as she can be at 103. So I've seen it all, I think.
Are you able to do Zoom meetings with her and things like that?
With the caregivers.
Okay.
Yeah, she is in a decline for sure. She has cognitive decline, and she still tries to get up and down on her walker, but she has osteoarthritis and other chronic conditions that you can imagine we all probably would get when we reach 103. But although I've seen pictures of people that are 103 and they're dancing, so I guess each person is a little bit different.
Absolutely. Absolutely. And what steps are you all taking when your caregivers go into the home to help protect everyone from COVID right now?
That's a good question. So mandated by the state, we are licensed by the state of Texas, and we are mandated to screen our clients and our caregivers on a daily basis, which we do. And basically the screening questions concern, do you have temperature? Do you have visitors? Do you have any of these known problems that come with COVID, although not necessarily all of them appear, like fever. You don't always get a fever when you are positive for COVID, things like that. So we have to screen them. A lot of our caregivers, we have to screen if they've been out of the country and have to have them, isolate for a little while before they go back to work. We try not to have our caregivers, we don't have our caregivers going in and out of communities. That's not a good thing. And basically, home healthcare companies, they're not allowed to do that. Most communities are not letting new residents come in yet. There was a little window where they were opening their doors, but then it's starting to close again. But they do allow people who work with seniors to come into the communities. So we have been able to still visit with our clients and have that consistency and continuity that they all like to have.
Excellent. And is Home Instead Senior Care currently accepting new clients?
Yes. We've been getting referrals from all over, as you can imagine. It's hard for people who do have other chronic conditions or do have a need for having surgery that's not really planned, but it's not emergency surgery. And so they need help to be at home while they're waiting. That's for one thing. And because it is unsafe out there, and some of the families do not believe that communities could be as safe as the home environment is, that more and more people will be remaining in their homes or being discharged to home or even sent home from the emergency room because they can't care for them in the hospital just yet.
Okay. Yeah, I think we're going to see a huge uptick in people needing home care because they're not able to be admitted to other places where they would normally be going to. Right.
So they are home. We're not having any problems with caregivers, fortunately. We, COVID is a very bad virus.
Yes.
And we currently are not taking clients who have COVID. We're trying to let the medical personnel, the home health care companies, take care of those clients because of their situations are much more adaptive to that than ours are.
So I know that you all could just hear my group of yippers, and I have seen your kitty in the background there. He's actually your coworker, if you didn't know that.
That's Louie.
That's Louie. And then I heard a puppy back there too.
Oh, well, you have Archie and Edith. I don't know if I can do that.
I don't. Oh, there they are. Very nice.
On my left, and that's on the pillow.
Very nice. Very nice. I think it's great that we all have our coworkers, our team.
Yes.
Taking good care of us.
They're a focus of reality for us, for sure.
Yes, they are. But you know, when I get older, I want to have them by my side too. So it's going to
Always,
be perfect.
always.
Well, good. Do you have any final thoughts for our viewers today, Nancy?
Well, besides stay safe, wash your hands, wear your masks. We are here to help you. And if you have any needs that cannot be met by family members, we are there to do your errands, to make you meals, to take care of your personal hygiene if that is what you need care with. And you can reach us 24 hours a day, 7 days a week.
Great.
Our phone is always answered by a live person.
And what number do they call to reach you, Nancy?
972-239-3934.
Thank you so much. I'm Kathleen Warshawski with Seniors Blue Book. This was your Senior Care Spotlight. And thank you again to our guest today, Dr. Nancy Oppenheimer-Marks with Homestead Senior Care. Thanks, Nancy.
Thanks, Kathleen.